All right, we're 1 minute past the hour. Good afternoon, everyone. My name is Desmond Banks. I'm a clinical assistant instructor here at the Boise State University School of Public and Population Health. I'm also the chair of our continuing education committee, and I'd like to thank my co-members, committee co-members here today, Ms. Haley Stewart, Mr. Andy Howier, Mr. Brian Young, and Mr. Dr. Mac McCullough. Thank you all for helping to make this tremendous presentation available here today. We're really in for a treat today. We have some great individuals going to talk to us about strategies to support our aging Idahoans and their caretakers. Presenting today will be Miss Lynn Fyanes, who is an instructor here at Boise State University and also a program specialist at the Idaho Commission on Aging. We also have Miss Sheila Weaver, also an instructor here at Boise State University, and she's also the program manager for the Family Caregiver Navigator Project. Without further ado, Ms. Fines and Ms. Weaver, take it away. A few housekeeping notes before I hand it over. Please save your questions for the end. You can unmute yourselves. However, please feel free at any time to put questions within the chat, and we'll make sure we take record of those throughout the presentation. So again, please save your mute yourselves and feel free to unmute yourself towards the end with questions. But throughout the entire presentation, feel free to put questions in the chat. Thank you. Ms. Fines, over to you.
Okay, well, thank you, Dr. Banks, and thank the BSU committee for having me today. I'd like to celebrate it's Caregivers Month. November is designated as Caregivers Month. So I want to give you all some information that you may not even know. So I'm happy to share with you today. So thank you for joining me today. I'm Lynn Fines. I'm a program specialist for Idaho Commission on Aging, primarily focused on caregiver supports. And today I'll be presenting on the public health needs of Idaho's aging population, an increasingly important topic as our state's demographics shift from a caregiving support perspective. Idaho's seniors population is growing rapidly, and with that growth comes a range of public health challenges. This presentation will explore those challenges, especially the differences between rural and urban needs and how our public health systems can adapt. First, I'd like to review what the Idaho Commission on Aging does. We are a planning agency that strives to maximize resources and capacity through strategic collaboration and partnerships. Idaho Commission on Aging enables older adults and their caregivers to live with the highest possible level of safety, dignity, and choice. Through our 6 area agencies on aging, ICOA focuses on 5 strategic pillars to 1, keep learning, 2, stay healthy, 3, staying connected, 4, stay home, which focuses on supporting Idahoans to live independent and healthy lives in the communities of their choice. And we do this through home delivered meals, homebound and isolated seniors. We can provide them adequate nutrition. And in fiscal year 2025, we provided over 500,000 meals delivered to over 4,000 older Idahoans and over 24,000 supplemental food program boxes through the 64 Idaho food agencies, serving over 2,000 older Idahoans monthly. So anyway, ICOA's National Family Caregiver Support Program aims to empower and assist caregivers by providing a range of supports, person-centered, evidence-based counseling and training, support groups, and respite care. In state fiscal year 2025, over 29,000 hours of respite care, 774 hours of caregiver training, and 127 support group sessions were held. Just to give you a little idea of the services being provided. Currently, about 17% of Idaho's population is over 65, and that number is expected to grow by over 30% in the next 6 years. Many of these individuals live in rural areas where access to care and services is more limited. Further, as Idahoans age, they may need home care, which is why I want to focus on caregiving for a few minutes. I want to illustrate how caregiving is deeply intertwined with public health, especially as populations age and chronic conditions become prevalent. Hold on one second. First, family caregivers provide more than $3 billion in unpaid care each year in Idaho, helping family members live independently at home where they want to be. In Idaho, nearly 3 in 10 adults are family caregivers. This slide illustrates the main condition or illness caregivers provide unpaid care for. Across the U.S., caregiving has become longer term and more intensive. 30% of caregivers provided care for 5 or more years. On the average, caregivers spend 27 hours per week providing care, and 24% provide 40 or more hours per week. 2/3 help with activities of daily living, which is bathing, dressing, toileting, feeding, and mobility. Just over 8 in 10 caregivers assist with 3 or more instrumental activities. Many handle medical or nursing tasks, yet only 22% have received training. And training often comes from nurses or doctors when available. Caregivers manage medications, appointments, nutrition, and mobility. They are essential in preventing hospital readmissions and supporting aging in place. Coordination with healthcare providers is another common core task, so you can understand the importance of having a circle of support. Public health can help train and empower caregivers to improve care quality and reduce system strain. To add to this caregiving role, 54% of Idahoan caregivers are also juggling full or part-time jobs, resulting in reduced work hours or having to leave the workforce, which jeopardizes their own financial security. 80% pay out of pocket, averaging about $7,200 each year, and 47% report financial setbacks like struggling to afford food and medicine. And nationally, 28% report it's very difficult to get and sustain affordable services in their local communities. And let's not forget the student caregivers. This is a slide created by our own Idaho Caregiver Alliance. Today, we'll briefly focus on 5 key public health areas, which are healthcare access, chronic disease management, mental health and dementia support, nutrition and food security, and housing and long-term care our older adults and their caregivers may have to deal with. Many seniors rely on Medicaid and Medicare, and that helps to reduce the health disparities by ensuring access to care for vulnerable seniors. They support aging in place through home and community-based services, and they help to manage chronic conditions, reducing hospitalization and emergency care, and are essential to caregivers who rely on these programs to support loved ones. Because Idaho is large and mostly rural western state, where 35 out of 44 counties are rural, geography and distance impact the health and safety of Idahoans. The residents of Idaho's rural communities tend to be older, experience higher rates of poverty, and lower per capita income, and have higher uninsured rates compared to their counterparts. Many seniors live on fixed income, and about 10% live below the poverty line, and income thresholds for assistance programs are set very low. Senior Health Insurance Benefit Advisors, SHEBA, offers free, unbiased Medicare counseling to help seniors navigate coverage options, and Medicaid offers programs for eligible adults, children, and adults with disabilities. There are also certified family homes and more. Please note that Medicaid services that are administered in Idaho are moving from the traditional fee-for-service system to a managed care model. And future listening sessions start on December 15th, so Idahoans can help shape the program to reflect the needs of Medicaid members across the state. And there's a link attached on the slide. Other public health concerns include high rates of diabetes, heart disease, dementia, and chronic conditions are interconnected and widespread in Idaho. The Alzheimer's Association reports 73,000 unpaid caregivers provide over 116 million hours of unpaid care, valuing $2.3 billion. Prevention and early detection and coordinated care are essential, and community support and caregiver resources are critical for dementia care. That's why Idaho has developed the Community Care Program, and in state fiscal year 2025, assessed over 200 caregivers, providing 168 with case management. Also, the Idaho Community Care Program has provided over 330 caregiver training hours with the Powerful Tools for Caregivers courses or workshops and the Savvy Caregiver workshops. Also, 27 support groups throughout the state. Programs like Fit and Fall reduce fall risk and are offered at several locations throughout the state. And the Idaho Falls Prevention Coalition offers clinics, free assessments, and webinars throughout the year. Now, Idaho ranks 48th in the nation for geriatric clinician availability. So increased capacity to meet the needs is essential to improve the quality of life and health outcomes for older adults in Idaho. According to Idaho's Community Care Program, which is that program designed to provide support to caregivers caring for a loved one with memory loss, 63% have reported a high stress burden. Caregivers face the challenge of taking care of their own health as they focus on their care recipients' well-being. Caregiving can affect both physical and emotional health and have reported feelings of isolation. But positive emotions often coexist with feelings of isolation, stress, or strain. Half report their roles give them a sense of purpose or meaning in life. Other concerns are nutrition and food insecurity. Through ICOA's Congregate Nutrition Program that serves Idahoans age 60 and older, and in some cases their caregivers, meals are provided to eligible participants at senior centers or other group settings. Over 12,500 clients were served in 2025 and over 474,000 meals. ICOA also provides home delivered meals to over 4,300 clients, and over 500,000 meals were delivered. And we cannot forget the Idaho's Commodity Supplemental Food Program for low-income seniors. An average 32-pound box may contain cheese, canned meat and fish, vegetables, cereals, and oats, and canned fruits. And partnering with the 64 Idaho Food Bank distribution agencies, over 2,000 seniors were served monthly with 24,880 food boxes this past fiscal year. Well, now there's a shortage of affordable and accessible housing for seniors in Idaho. Many older adults prefer to age in place, but home-based care services, especially in rural areas, are underfunded and understaffed. This creates a real gap between what seniors need and what's available. Regarding home-based care services, rest assured, Idaho's Healthcare Workforce Collaborative and Idaho's Department of Health and Welfare Rural Health Transformation Plan are addressing the direct care workforce shortage by developing career pathways, recruitment and retention incentives, and also deploying technology to monitor and educate. Also, Our Idaho is fighting for common sense solutions to help save caregivers money and time and provide greater support. At the federal level, ARP is working to save caregivers money through the Credit for Caring Act, a proposed federal tax credit of up to $5,000 for working caregivers, and the Lowering Costs for Caregivers Act, which would expand flexible spending and health saving account uses and health saving account uses. Further, Idaho has several key programs supporting older adults, like conducting community health assessments, which help guide planning. The Idaho Commission on Aging coordinates services like transportation and meals. Area Agency on Aging serve local communities and organizations like the Idaho Caregiver Alliance, provide essential support. So next, I've invited my dear friend and colleague, Sheila Weaver from the Idaho Caregiver Alliance to discuss Idaho's Family Caregiver Navigator and ways we can help support our family caregivers.
Thank you, Lynn, and thanks for your ongoing work to support caregivers here in Idaho. I'm really proud to be here today, and I'm really proud to be part of FPPH every day, but particularly today, because the School of Population and Public Health has really provided a home for us and has really shown a commitment to kind of housing the Idaho Caregiver Alliance and the work we do to support caregivers here in Idaho. As Lynn talked about, when thinking about older adults, 1 in 3 people are acting as a caregiver. So we often say in our line of work, we're either going to know a caregiver, need a caregiver, or be a caregiver. And we do these kind of presentations all the time. And I don't think there's ever not a time where somebody just doesn't understand what we're talking about. We're all really impacted by caregiving in one way or another. Um, so with that, the Idaho Caregiver Alliance, we've been around for just over 10 years, and our goal is to really be that voice and convener of family caregivers across the lifespan. So we are serving those folks that are, everybody from like college age caregivers who may be caring for a sibling with mental illness or a grandparent to spouses caring for each other to parents with kids with disabilities to older adults and kind of everywhere in between. So we really see ourselves in this kind of wider caregiver space. And so with that, in 2020, the Idaho Caregiver Alliance developed what's called the Family Caregiver Navigator Program. So we are a free service for caregivers is really what we are. So we're free, we're low barrier. We serve caregivers of all ages. Everything we do is by phone. When we first started, there was this real look at doing more in-home type stuff, and then COVID came along and kind of changed the game for us. And I think it's worked out really well because it's given us an opportunity to reach caregivers quickly across the state, and you haven't got to clean your house before we get there. You haven't got to figure out an appointment. We can just call you and get it worked out. We're evidence informed, and again, all family caregivers are welcome. So we can fill a lot of those gaps. A lot of caregiver supports, they're focused on aging, or they're focused on a disease or something else. And we just really meet caregivers. We have the opportunity to really get to meet caregivers wherever they're at. And this is our contact information below. But I'll go ahead and move on to the next slide. Am I the flipper? Thank you. Thank you. And so when we think about that, with that Family Caregiver Navigator, we've seen some nice results come out of it. We've seen a nice um, maintenance of home-based care. So when we think about home-based care, these are people that are calling us and saying, I don't know what to do, or they're calling us and saying, I don't know what to do. I think I'm going to have to place my loved one in some kind of long-term care facility or some kind of residential facility. And so what Family Caregiver Navigators been able to do is either decrease or maintain that intent to place their person in a longer term care facility. And that's really important to the taxpayers of Idaho and our community. If anyone's priced out any kind of like long-term care or residential situation lately, we're talking over $100,000 a year per person. That's generally coming out of Medicaid dollars and or some kind of private, incredibly expensive private pay situation. So it's an incredible value to taxpayers. And we've experienced a really nice improvement in well-being. So we've seen that nice drop in depression and a really nice drop in identity discrepancy. And for folks that aren't familiar with that, identity discrepancy is this kind of negative psychological state that it really appears in caregivers when they don't really know what their role is anymore. And I think about this gentleman that called us a few years ago, and he had this really neat kind of almost co-parenting relationship with his dad. I don't know where the mom of his child was, but he had this young son, and him and his dad were just buds, and they'd go fishing together and take the son places and all these things. And one day, the grandfather got in this pretty significant accident and acquired a pretty life-changing injury overnight. And so this gentleman went from having a dad who was, picking up his kid from school and going fishing and doing all these grandpa and dad things to needing almost round the clock, toileting help, supervision, rides, everything, any kind of coordination in his life. And so this gentleman's saying, am I this person's caregiver or am I his son? Like, I don't even know who I am anymore. And that's what identity discrepancy is. And so, can really be jarring for folks. When we see that drop, it's really powerful for people. And we'll go ahead and go on to the next slide. So this is how to contact us. Again, we try to make our entry as simple as possible. So if you or somebody you know that's in need, please don't hesitate to give us a call, send us an email. We are happy to reach out to caregivers however we can to really get them that navigation support that they need. And we have that capacity as well that we it's hard for me to think about an organization that we don't partner with. So sometimes folks call us like looking for very specific dementia support. So we're able to connect them to places like community care, or whatever, or meals on or home delivered food programs or whatever's going on there. If folks have a little more time, they can hit that blue refer a caregiver button right on our website. We ask 3 questions. Are you over 18? Are you overwhelmed? These very simple questions to get people connected. Because again, we do have that low barrier program. If once somebody identifies as a caregiver, they are a caregiver. They don't have to have a certain kind of insurance or anything else. And we'll go ahead and go to the next slide. So I just ask you, I'm not asking for any kind of out loud time here, but in my line of work, I've worked with families for most of my career and the last 10 as a social worker. So I really do kind of just encourage you to think about who are the caregivers in your life and in your work. Like, where do caregivers kind of pop up for you and how can you support them? And we'll move on to the next slide. Caregiving's big. There's a lot happening in the caregiving world, but it's not impossible to support caregivers. So these are some very tangible ways that we can support caregivers. These are things that we don't need to have a master of public health or a master of social work or a doctoral level degree to support caregivers. We can all start doing it. We can all do it today if we're not doing it already. So we can help folks with, help, giving a caregiver a break and giving somebody a ride once a week is a game changer. Helping caregivers with errands or tasks, checking in with them. We see a lot around social isolation and caregivers. So we see people going to this caregiving role, and then suddenly their friends start disappearing, their life starts disappearing, and it's very lonely to be a caregiver. And recognizing caregivers in your life, even if they're you. I'd be willing to bet on this call there are several people who've acted in a caregiving role one way or another. So if you're a caregiver, I want to say thank you so much. And we'll go and move on to the next slide. And I just love to share this quote. Analysis suggests that recognition of oneself as a caregiver is produced primarily through interactions with others. Without external influence, family members will often see the work they are doing as simply an extension of their relational role. Idahoans are great at this. Well, I'm not a caregiver. I'm just the daughter. I'm just the husband. I'm just the whatever. I'm not a caregiver. I'm just doing what families are supposed to do. But we know that once folks start really affiliating themselves as a caregiver, it can have incredibly positive benefits. But they're generally only derived when other people are saying, hey, you're a caregiver. You're not just a daughter. You're not just a spouse. You're not just a husband. You're a caregiver. And kind of help people kind of start to take on that, kind of see themselves in that role so they can connect to things that can really help caregivers. And I'll go ahead and pass it back off. And I'm just like Lynn is, I'm sure I'm here at the I'm here at the university. We're both always very happy to talk about caregivers, so please don't hesitate to reach out. We love talking about caregiving. And thank you.
Yes, thank you, Sheila. Thank you for the Caregiver Navigator as well. What an outstanding program. Um, so let's look at some of the challenges ahead. We face several. I mean, there's a growing shortage of healthcare workers trained in geriatrics. The digital divide limits seniors' access to telehealth and online services. And policy changes, especially around Medicaid, could disrupt care for thousands of Idahoans. However, let's remember, Idaho has the best of the best working on these issues. Further, to address these issues, Idaho needs to expand their rural health infrastructure and increase funding for home and based community services. Improving digital literacy among seniors will help them access more resources, and we must invest in caregiver support to prevent burnout and provide care quality and improve care quality. On this note, Idaho has applied for up to $1 billion in the federal funding through the Rural Health Transformation Program to help expand rural health care infrastructure recruit and retrain healthcare workers, among several other initiatives. The role public health can take, they can help us advocate for workplace supports. Healthcare can help recognize caregivers' need for non-clinical support. Data collection can help meet caregivers' needs. Of course, the need for culturally appropriate communication. And programs that provide caregivers with the tools they need to care for themselves and their care recipients, like the Caregiver Navigator. I think through the Commission on Aging, our 6 area agencies on aging, the Idaho Caregiver Alliance, Idaho's Department of Health and Welfare, Janice's Aging Strong, our 98 senior centers, Learn Idaho, our libraries. Idaho has a strong system of support. However, caregivers can always use support, whether it's through their workplace, our healthcare systems, volunteerism, education, friends and family, and also just a solid policy or solid policies. Idaho's aging population presents both challenges and opportunities. So with thoughtful planning and investment, we can ensure that older Idahoans live healthier, more independent lives. Collaboration across public health, social services, and community organizations will be the key. Together, we can help raise awareness, collaborate, and offer to help our friends, neighbors, and coworkers and family to providing care. And that is all we have for you this afternoon.
Excellent. Thank you very, very much, Ms. Fyanes and Ms. Weaver, for a tremendous presentation today. And now we can open it up to the group. Please feel free to unmute yourselves or to put questions in the chat, and we will go ahead and read those off for you. I see a hand raised. Ms. Clappin, go ahead.
Hi, everybody. Thanks for being here. I want to thank you, Sheila and Lynn, for your work on this critical pressing issue. Hopefully I can articulate my thoughts well, because I have a number of talking points to address here, and I just want to synthesize those. So, firstly, I moved to Idaho in 2023 and was a professional medication technician slash caregiver on the knock shift, as you know, is the overnight shift. until my industrial injury in the summer of 2024. So to address, so I guess my question is, in my experience, just as a like not even as a family member, an unpaid caregiver, as a paid caregiver, I feel I have witnessed that caregivers professionally are underpaid and overworked. It's an extremely laborious position. Um, and often by the chain of command that we work for, we're looked down upon because we're not registered nurses or we're not managing the facilities that we work in. So I'm just wondering, is there an effort in Idaho to unionize for better wages? We often work be like under a living wage.
Um,
Also, in Connecticut, they removed managed
Ms.
care
Clapper,
organ.
let's pause if we can just to get because I know it's if they can address that one, then we'll give you some time to ask the second one.
Okay.
Yes, ma'am.
Lynn, you've got your project going, and I'm happy to hop in as well.
Yes, Jane, yes, that's not only an Idaho issue, that's a nationwide issue. Um, I can say that Idaho is working on the direct care workforce, and yes, they are fully aware that they are underpaid, underappreciated. We're working on several different types of career pathways. I just had a meeting yesterday regarding entry level certifications and ways to promote a professional pathway for medication techs, for the entry level health behavioral assistance. So yes, it's an issue we are constantly addressing, and I hope to see some massive improvements in the future, especially with maybe the rural healthcare investments being made. Um, and other business plans that have been proposed through the Department of Labor. Sheila, would you like to?
Yeah, I just put something in the thank you for that, Lynn, because Lynn's doing tremendous work in that space right now, and I just put a um a link in the chat. The Office of Performance Evaluation a couple years ago did a pretty significant report on the direct care workforce and really found out, as they said, that we have a direct care workforce crisis. We're likely, and this is pretty conservative of what they said, we're likely short about 3,000 caregivers in the state of Idaho. And we really are, and particularly in the border areas, really getting nailed. I just talked to a professional caregiver last week in North Idaho, and she said, I can either work in Washington and get paid like $38 an hour or something, or I can work in Idaho and get paid $15 an hour. And COVID really hit these folks as well, caregivers as well. I mean, I think there was just this real barrier happening. And I think about it, like I drove by Del Taco 2 nights ago, and I think they're paying $18 an hour. And so if I'm a caregiver and if I'm looking for a job and I think, man, I could go work at Del Taco and get a shift meal and make $18 an hour, or I could be a caregiver and have to help people in the bathroom and get accused of stealing jewelry, I'll tell you what I'm going to pick, So people in that professional caregiver space has a real heart. We have a real heart for caregiving. But because those folks are getting squeezed and there's not as many, these family caregivers like Lynn and I were talking about, they're getting called up more and more because there's just literally nobody to care for people in our community. There's no, the number of professional caregivers in our communities is small, to say the least.
Uh, Ms. Fines and Ms. Weaver, thank you very much for that. It was eloquent responses. And Ms. Clapton, thank you for bring your real life lived experience and posing it as a question here. Part two, I didn't mean to cut you off. I just wanted to give them time to, digest because that was a lot. But second part of your question, go ahead.
Yeah, no, I need to be cut off.
Sheila,
Thank you
Right.
for that. Thanks for keeping me in line. I need it. Also, thank you both for your responses. If there's anything I can do to help with that movement to increase wages, let me know. Um, Also, I want to speak to policy. If you're familiar with the wiser model being introduced at the first of the year, because I know Connecticut is a good example. It's where most health insurance companies are actually based out of, but they removed their managed care organizations from their Medicaid programs and have since saved $4 billion a year. And in my head, I think that could just be when we think about underpaid caregivers or lack of resources, particularly in a rural state like Idaho, that removing managed care organizations from Medicaid in our state could have a lot of could affect a lot of positive health outcomes. And I just wondered if either of you would like to speak to that. And thank you again.
I have very minimal information on the Wiser Act. I mean, on the Wiser model. I just put something about it in the chat. As you know, we started moving toward this managed care model last year. I don't know that I have any strong advice on what to do. I think there's space right now to to provide education around, to Lynn provided part of that link around the managed care model, to provide feedback on the managed care model. And also too, I think that will continue to benefit from an educated populace and educated people in this space. So I really do encourage people as these issues arise um, to be a part of those decision-making processes and show where we can to be a part of those. And Lynn, I know you've got more on the managed care comp feedback.
Yeah, I don't. I actually have to I totally agree. Jane, in this presentation, there's a link to those talking forums that they're going to have starting December 15th. And it would be really great if you could be a part of those discussions, because Idaho Medicaid is bringing in the managed care MCOs to replace the value-based care. What that looks like in the future, I don't know. It hasn't started yet, but we need to get in there at the ground floor and provide input and feedback. That's what they're asking for right now, and that's going to be very important. So thanks for bringing that up.
Count on me to be there.
Absolutely. And thank you for those who've put questions in the chat. I'm going to try to blend one question in here with just doing some level setting. Again, Ms. Fyanes and Ms. Weaver, thank you very much for highlighting this critically important topic. I just want to bring your attention also, I'm going to put it within the chat here. There's a landmark study that was conducted by CDC during COVID-19, and it really it explored the impact that the pandemic was having on behavioral health outcomes across a wide variety of audiences. They look at things across, education and income, race, ethnicity, you name it. They also examined essential workers, right? Something that we didn't, really hear about before the pandemic, essential versus not essential. In addition, they also explored those who were under the status of unpaid caregiver status. And I just put that within the chat here. I'll put it with there again. And when you look at that report, by far, some of the greatest disparities in behavioral health outcomes were among those who were in that status, unpaid caregivers. Specifically, about 33% of individuals who identified as unpaid caregivers started or increased substance use to cope with stress from the pandemic. 33%, compared to just 6% of those who were not unpaid caregivers. Okay. And again, 31% of those who are unpaid caregivers seriously considered self-harm, compared to just 4% of those who are not in that status. So when you look at those 5-fold, 10-fold differences in behavioral health outcomes, just by those individuals who are within that unpaid caregiver status just overall, and then you throw in something like the pandemic, it really shows the monumental amount of pressure and the significance and importance of that position. And I'll end the diatribe with this question here. There are some states who are considering, because of how hard how important they are, of reimbursement through Medicaid. Is that something that is possible here within the state, or are there any initiatives or advocacy groups that are looking towards payment in some way, whether it's reimbursement through Medicaid or something for our unpaid caregivers?
My answer to that would be ARP is looking at some of those tax breaks for caregivers, for unpaid caregivers, at a policy level, at a federal level and state level. I know our state provides the commission some great funding to help with nutritional meals and dementia supports, so on and so forth. but I could not I cannot talk for Medicaid by any means. I'm not a federal agency and I'm not a state. I can say that our government has been very, very, very good to us as an agency, as a state agency.
Thank you, Ms. Fyanes. Absolutely. Absolutely. There's another question we have in the chat from Taylor. I hope that I'm not butchering this for you. But Taylor states, I'm curious about the proposal you mentioned for caregiver credits. Where exactly is that, and what would a realistic time frame look like for those caregiver credits?
Well, that's a good question. That'd be a really good question for ARP. As a matter of fact, they usually hold family town halls with the governor. So that would be a really good question to ask ARP. And keep your eye out for Facebook and look for those town halls because they can give you the specifics. As a matter of fact, I do have some documentation from ARP that I could share with you if I have your contact information and give you a little bit more background and feedback on what their policy initiatives are for this next legislative session.
Absolutely. Thank you, Ms. Fyanes. I have another question here. And Elizabeth, please feel free to chime in on this one if I'm not capturing it correctly. And at first, this will probably more, qualitative or anecdotal. I'll read the question. Is anyone aware of how current federal policy or actions related to immigration are impacting the caregiver workforce in Idaho? I'm curious if undocumented or illegal immigrants who may have been working as professional caregivers have left their jobs or the state out of a sense of threat from immigration removal or from ICE.
Really
Well,
good question. I
go
haven't
ahead,
seen any
Lynn.
data on that, but go ahead, Sheila, please.
Yeah, I think you're exactly right, Dr. Banks, about that anecdotal information that's kind of coming through right now. This is what we know for sure. Spanish speakers they are the second, I mean, they are the largest minority in the state of Idaho. So I can't believe that they're not impacted by what's happening right now in the state. And our office has done a fair amount of work with the Spanish-speaking community throughout the years. We know that Spanish-speaking caregivers have already been getting the fewest sources of caregiving help for information. We know that they're generally younger than other caregivers. They're giving up paid work entirely more often than their peers. Um, so I can't help but believe that just with my own knowledge that they're not being impacted. And then we had kind of an interesting situation happening earlier this year it's been kind of stuck in my head, and I'll just share this with you. We had a Spanish speaking caregiver conference 2 years ago with we maxed out every single spot. We were very excited to have it. We had it at the Hispanic Cultural Center. Um, we had 100% positive feedback. People were very excited to come back last year. This is in 2024. We had our second conference this year in 2020. We had our conference, then we had same conference again, this year in March of 2025 in a very different environment, I would say. Um, and so we started the conference. Everybody had RSVP'd. 12 people showed up. And then an hour later, five more showed up and six more showed up. And we eventually got to this number, but we started kind of talking to just our vendors about like what's going on. And they're like, people aren't coming out right now. So we know that I don't believe, I shouldn't say we, I don't want to, Lynn for want to put her own thoughts on this. I do not believe that the need for Spanish speaking caregivers has gone away. I do not believe the need has suddenly vanished for Spanish speaking caregivers. I am concerned that they may be experiencing more barriers right now. And that's what my concern is. So I don't know I don't know if there's data out there on that right now, but that's just kind of what I've seen in the past 6 months.
Thank you very much, Sheila. And that is data, your qualitative lived experience of observing those. So we thank you. Thank you very much. Any other questions?
I have a question about the Hispanic community and caregiving. If that's all right.
Absolutely. Go ahead, Lou.
My question is more about like within that community, have you guys seen a higher percentage of caregiving being for individuals that are of an older age, or is it for individuals that have um, developmental disabilities or an other type?
I haven't seen anything that leads me to believe that Spanish-speaking caregivers are caring for different types of care recipients than other caregivers. Um, I personally have not. Lynn, have you seen anything?
Not within the state of Idaho.
Okay.
I mean, I may have to dig deeper into, national statistics, but that's a really good question, Libby. Libby, I've never seen those demographics broken down like that.
And can I also ask a follow-up question?
Absolutely.
I'm also curious if you guys have, I don't know if this has been studied, but if there is a difference in burnout rate between the Hispanic population and other populations. This like uh, coming from a like I know the Hispanic community has a very communal way of looking at things, whereas other populations might be a bit more individualistic. And in my head, I'm assuming burnout would be affected and like they would burn out less because they are more communal.
I haven't seen data on that, but what I have seen is that Spanish speakers generally talk about caregiving as almost more of like a family value and
Mhm.
see more like satisfaction and fulfillment as a caregiver. And so I don't know how that hits the numbers exactly, but that's what I've seen.
I'd have to
That's
second that feedback. I'd have to second that feedback. It's
that's
very
very
much
interesting. Thank you.
yeah.
Is this something your organization would ever like study, or is that not part of your scope of practice?
The Caregiver Alliance has. I just put a link to our website, to our stuff on it. We've had a colleague in particular doing a tremendous amount of work in that Hispanic family caregiver space and really talking. I wish she was here with us to talk about it. But around some of those Spanish speaking kind of family values and have some of those different stories of family caregivers and some barriers they experience. So I just kick that all to you. So you can check it out if you want to. I feel like I'm blowing up the chat with links, so I apologize.
That
No
would be a really
apologies
good
needed.
resource because we support the Older Americans Act. We support older Americans and Hispanics, and we take demographics on the uh, what percentage of the Hispanic population did we serve, but we don't necessarily take demographics on what type of disability. It's usually just an older adult, if that makes sense.
And if Dr. Neer was here, Dr. Neer, Dr. Taylor Neer, she assisted in some of that work around identifying how unique barriers and cultural values really influence service utilization of caregivers. And so I just threw that report to you, but Dr. Nehar may also be a resource on that.
Thank you, Libby, for the questions. And thank you, Ms. Fines and Ms. Weir, for um, your informative responses there. Ms. Teixeira, I see your hand up. Go ahead.
Oh, thank you for getting my name right. Most people don't. No, I appreciate that very much. I'd like to follow up on some of Libby's comments. Um, we have made in the United States some significant increase in people being able to die at home and die more the way that they want to. Less people, significant statistical drop in the number of people that are dying in hospitals. Now, of course, that raises the question, is that simply because there's no coverage for them? You know, they don't want to take them to the hospital for that. But I think Libby is onto something as far as Americans, a lot of our programs, and I've worked welfare and things like that, and I'm not going to get on my soapbox, but we've done a pretty good job of breaking up family units and community in the United States. It's not something that I think we should be proud of. For instance, aid for dependent children. You know, if you're a single mother with kids, fine, you can get some help. But if the husband's in the household, maybe you don't. It's broken up families. I've seen that. And I do think that a friend of mine just moved his father to a personal care facility, which those are really unlicensed, and that can be a problem. But the reason that he couldn't get him anywhere else was didn't qualify for skilled nursing care, but no memory care will take him because he had a catheter. They wouldn't touch him with a 10-foot pole. So, these are things that we have to think about as our uh, population is aging. And I want to thank Sheila and Lynn for telling me about all of the things that Idaho has. And I was out looking on the AARP site when you mentioned it just to see what else they have there. So this has been a wonderful presentation, and I noticed that a couple of students from a class I'm teaching are on this. So I'm really glad to see that we have our up and coming healthcare people attending some of these sessions. So thank you.
And I appreciate you saying that. I'll put it in the chat, just like I have a bunch of other stuff. But UCLA just put out a study fairly within the last year or so about this shortage of hospital beds and kind of painted this grim picture of how there will not be enough hospital beds for everyone to die in. And I think that very much kind of plays into this piece of what you're talking about, and also too how caregivers are saving the United States a lot of money because when people don't have it, when they need help with that catheter, when they have nowhere to go to, a family caregiver picks up the slack for free most of the time, for more often than not.
Yeah, and I want to share with Dana, the Idaho Commission on Aging also has a pretty active website as well with some really good information and resources. I don't know if you've had a chance to look at that.
No, I hopped out on your website while you were talking, to take a quick
Okay,
look.
good.
And yes, I will spend more time on that. And I just think that, again, more community. We need to, I'm going to go all the way back to Thomas Paine. We need to be looking at the people to the left and right of us and saying that if we help to take care of other people, they help to take care of us. We need to become a community more and not, put people in niches. They're senior citizens, so, they're getting these services. And if I'm not working with a senior citizen, this doesn't touch me. It does. We're all part of the same community. And I think the more that we encourage that, the more that you will see improvements in your programs and support as well.
Totally agree with you. The way that sometimes the federal government sets those barriers. I mean, yeah, by their statutes, that this funding goes here and this funding goes there, and then we have this big barrier right in the middle.
I
But
can't
we do our
speak-
best. We do our best with the ADRCs to break that barrier down.
And Taylor, I can't speak for the organizers, but you can save that. I think the organizers can save the chat, but I will leave that technical question to the organizers. But yeah, the ICOA, and there's just a lot of organizations in Idaho doing tremendous work on fairly limited, with barriers and oddities in the community and lots of other things. Just really tremendous work being done to support caregivers in lots of different spaces in Idaho.
I just want to share one more thing with Dana is our website is being refurbished, so we're in the process of shuffling things around. So it's not a finished product yet, but there's resources are still there.
I like hunting. It'll be an investigation and an adventure. So thanks.
Our news and alerts right now is you'll see changes coming there. News and alerts.
All right, I see lots of activity within the chat, and yes, Taylor. In addition to having this presentation made available on our website, we'll also work to make sure that we can share those links to all in attendance. Excellent question. Absolutely. All right. Any
Taylor,
additional questions?
Taylor, I'm sorry. Feel free to email me, and I can send you that ARP policy letter that I received to show you kind of what they're focused on this year. If you could.
And is it okay that we just received permission to put your email in the chat, Ms. Fyanes? Is that okay?
Yeah, that's fine.
Okay,
I can't see the chat, so
that's
for
all
some
right.
reason.
That's fine. Thank you. Any additional questions?
Hi,
All right.
Sheila and Lynn. This is Jane again. I just wanted to thank you from the bottom of my heart for everything you're doing. It does not go unnoticed. And that date on December 15th, Lynn, what exactly, where do I get to that? Um, Especially if anybody else would like to join me.
When you say that, I'm not sure. I'm not quite sure what you're asking.
The managed care sessions, Lynn, that first one. There's
Yeah.
the first virtual one is in I'll put it in here again. I think it probably got buried in the chat somewhere, but this is all that's got all the listing. There's one in Boise in April 2026. There's a virtual one in February. December 15th is in Rexburg if you want to take a road trip. So
Okay, and that's the managed care is where I go to find the
yeah.
links to those and register. Okay, thank you so much.
Yeah, that's on slide 11.
Slide 11. Okay, awesome.
Thank you, Ms. Weaver, for putting those within the chat here. We'll make sure all this information goes out to all those in attendance. Well, I know I speak on behalf of our entire committee, Continuing Education Committee, and all those in attendance today. Thank you, thank you, thank you, Ms. Fyanes and Ms. Weaver, and to all who attended today for your excellent questions and feedback. We were truly blessed. And for those who are in attendance, please keep an eye out for an email or notification for our next continuing education session. I hope that you guys enjoyed this lunch hour. Thank you very, very much again for attending. Thank you all.
Thank you.
Thank you.
Absolutely.